Good evening. So I'm Rochelle D. I'm the program director for Baylor College of Medicine, Houston, Texas. And I have my team here. So I just wanted to introduce them to you and we'll go over some of the stuff. But just an overview of Baylor. We are proud to say that we have been one of the oldest programs in the country. We have been in existence for the department for more than 70 years. And we have graduated, maybe a third of we have graduated alumni who have gone on into leadership roles, both nationally and internationally. About one third of the chair of the programs of PM&R nationwide have connections, if not graduated from the Baylor program. And so we're really proud of that legacy and we want to continue that. And with that too, with the evolving pace of physiatry, our goal and mission is to really continue to evolve in our curriculum based on the needs and the future of our practice. So I'm going to introduce my team. Dr. Donna Huang is one of our associate program directors. She is she's in charge of our recruitment committee. Donna, I'll have you speak a little bit more about recruitment or how we do our selection process.
Yeah, sure. So hi, everyone. Like Dr. D said, my name is Donna Huang. I'm one of the assistant program directors. And in my clinical hat, I work in spinal cord injury at the VA. And like Dr. D said, I chair our residency recruitment committee. So basically, the process of recruitment comprises kind of two major chunks. There's the screening part of things, which involves reading all of those documents that you guys work so hard to prepare and gather in order to showcase all of your hard work that you have been putting in to reach this point in training. So that is a pretty extensive process that enlists a lot of manpower in our department, but it is important to us to screen every single application that we receive. So we really try to holistically consider a variety of attributes and experiences that you bring to the table and consider how those kind of fit with the priorities and needs of our training program, but also, think about sort of selecting the type of applicants that we think will be successful and thrive and, happy in our program ultimately. So that part is screening. So we read essentially all of the written parts of your application. And then from there, applicants are selected for interview. And so then our interview day is comprised of semi-structured interviews. So there are questions that are standardized across all applicants, and that is intentionally done to sort of allow us to compare apples to apples in a way. And then the semi-structured part of it means that there is still unstructured time for you to ask questions and also just kind of get to know your interviewer a little bit and essentially establish that connection and rapport to get a sense of the personality of the program. So yeah, that's essentially the high level outline of how it works. Yeah, if I can answer any further kind of questions about that, or if there's anything that you're curious about, I think in the overview of the program that the chiefs they'll have some contact information for us. So feel free to send them along. And yeah, just wish y'all all the best of luck in this process.
Thank you, Donna. And then also one of our other APVs, Associate Program Directors, is Dr. Angela Cortez. She is a sports medicine, and she is in charge of our didactics and also our mentorship program. Angela.
Hello. All right. I'm Dr. Cortez. As Dr. D mentioned, I'm one of the sports medicine attendings. And so, yeah, we have a standard curriculum that goes into blocks such as spinal cord injury, brain injury, stroke, musculoskeletal. We also have our ultrasound curriculum, which is every other month for the most part. It goes through all the major body parts. And I'm part of that and part of the teaching of that. We have, some big programs. We have a lot of machines that the residents get to use in groups. It's also headed or like assisted with Dr. John Sianka, who's quite an honor for us, at least for me. He's one of the he's written some of the textbooks and ultrasound curriculum and ultrasound sort of teaching, and I think he's going to be the upcoming president of PM&R. So quite an honor to have him do a lot of the teaching for ultrasound didactics. Also have a cadaver lab, and that's just also to supplement our anatomy. And then for mentorship, we have, so every year, once you start as a PGY2, you're matched with a faculty mentor based on your current preferences, knowing that sometimes your preferences in terms of where you want to go, like are you going to general PM&R or thinking about a spinal cord injury fellowship, those may change as you evolve. And so every year we get to, you are free to rematch, or I assist you in rematching with a faculty mentor to make sure that you're going the right track and have the right faculty to help guide you through your residency career. So that's everything in a nutshell. So yeah.
Great. Thank you, Angela. And then to give you much of the overview as well, for the details of the program curriculum, the rotations, I give you our stellar wonder twin of chief residents, Dr. Jason Caffrey and Dr. J. John. Take it away, chiefs.
Jason, I think you're muted.
All right, I hope y'all can see the slides now. Like Dr. D mentioned, I'm Jason Caffrey. I'm the academic chief. I'm joined by J. John, who's our administrative chief, and we'll be sort of giving an overview of the Baylor College of Medicine PM&R program via the slides here. All right, just starting with Baylor College of Medicine. We are a part of the Texas Medical Center, which is the largest medical center in the world. We're located in Houston, which is one of the most diverse cities. By some metrics, I believe the most diverse city in the US. We are blessed with a low cost of living, but we're still sort of connected to everything, 2 major airports, kind of centrally located to, a quick trip via plane to anywhere in the US. Our program really features a very wide exposure to different clinical settings. We get exposure to academic, private, VA, county, and then within there also children's hospital as well. So highlighting these clinical sites, starting with TIER. And so TIER is one of our major training sites where we spend a fair amount of our time on mainly the inpatient side. It's a 134-bed inpatient rehab facility. It's always ranked near the top in the national rankings. Currently, we have 6 fellowship-trained brain injury inpatient attendings, and we have a robust disorders of consciousness program there. We also have spinal cord injury with 2, I should update that. I think as of very recently now, 3 fellowship-trained inpatient attendings, as well as patients for transplant rehab, neuromuscular rehab, as well as general neuro rehab. We also do a fair amount of our training at the VA. So it's a very large VA hospital where we do a large portion of our spinal cord injury inpatient training, as well as we do rotation on general inpatient rehab. We do EMG, MSK, spine, and then interventional spine as well. All right. Another one of our facilities is Baylor McNair. So we do general inpatient rehab as well as, which just recently reopened this year, and MSK sports as well as pain and spine rotations. We do consults at a very large hospital, part of the Baylor network, the Baylor St. Luke's Medical Center. And we also, a fair amount of our training is done at Harris Health, which is a county hospital system. It's sort of flagshipped by Ben Taub Hospital, which is that large county catchment hospital where we do consults, as well as outpatient clinics at Smith Clinic, where we do EMG. And of note, sort of the point person there is Dr. Fei Tan, who's actually the current president of AANEM. So she's been an amazing resource for sort of educational and really sort of leadership opportunities there, as well as at the Gulf Gate Clinic, where we do general PM&R clinic and then have our high volume MSK joint injection opportunities. We do a fairly significant amount at Texas Children's Hospital. So this is a very, very large, I believe the largest pediatric pediatric hospital in the US. We do inpatient pediatric rehab as well as consults. And then we rotate through different sites of MSK and sports for pediatrics, as well as outpatient pediatric rehab. Then just highlighting some of our program academic key points. We have weekly didactics. These are faculty-led, organized by myself and also in collaboration with the UT Health Houston program. So we do those didactics together. It's protected each week for the morning on Thursdays, and as one key point, we have recently implemented more resident-led board review sessions, so sort of longitudinally throughout the year, targeting really key high-yield points to sort of help with taking small bits away at board review throughout residency. We have a number of workshops. We do an annual anatomy cadaver lab where we do sort of targeted prosections with clinical correlates for the brain, spine, as well as various joints and musculoskeletal structures. We have a spasticity and botulinum toxin injection course that we do each year. And then something that we just finished completing this first year, so this will be year 2, the MSK ultrasound curriculum that Dr. Cortez was alluding to. And we do this about every other month or so, and sort of rotate through all the different sort of high yield musculoskeletal structures. We have grand rounds each month. We have a number of journal clubs that many residents are quite active in. We have sports coverage opportunities, including local high schools, but also the Houston SaberCats, which is a professional rugby team here. That well, both Wanje and Dr. Cortez are quite active in, as well as research opportunities that are really throughout the Texas Medical Center. You know, Baylor tier, the VA, at the Children's Hospital, but you know, if you find something that an area that you want to do research in that isn't necessarily a focus of one of our faculty, the Texas Medical Center is so large, there's bound to be someone that does that research. Some folks who are interested in like cancer rehab or pain related to that do research at MD Anderson, which is just all within the Texas Medical Center. We also have PTO that we take for conference attendance. Just very briefly on calls, all of our call is home call, and we cover the Baylor McNair inpatient site, as well as the VA inpatient tier and Texas Children's Hospital. Just to give numbers, and these are the sort of this year's actual averages for PGY2, 3, and 4 years, with sort of a very traditional sort of front-loaded and tapering down through PGY2 down to 4. As Dr. Cortez alluded to, you're assigned a faculty mentor starting your PGY2 year based on your interest at that time, but of course can be changed sort of year to year. And there's a number of other faculty sort of all throughout that are happy to provide mentorship on a sort of formal or informal basis. We have a big little SIB family program, if you will, where we create PGY 2, 3, 4 families, and just to give an extra support for someone who's going to be a little bit more accessible or closer in case you need that. And then here I'll pass off to Wanje to continue.
Thank you, Jason. My name is Wanje. I'm an Administrative Chief Resident. Let me just highlight other part of the program. So in terms of the fellowship matching, next slide, please. we have successfully matched our residents into various nationally known fellowship programs. We matched brain injury, cancer rehab, neuromuscular medicine, palliative care, and also pain, as well as sports medicine. And in the past 4 years, when I talked to the upper level resident that I had worked with, I believe everyone matched into their top three ranked fellowships. And then majority of them actually are matched into their top two choices. So we here at Baylor, we have successfully matched many of our residents into the fellowship spots. Next slide, please. And these are some examples. Sorry, I forgot to mention pediatric rehabilitation as well, and spinal cord injury and amputee rehab. Next slide, please. And then here's a list of pain medicine and sports medicine programs that our residents matched into. Next slide, please. And another program highlight is the Baylor Alumni Network. Next slide, please. As Dr. D mentioned earlier, we have the largest PM&R alumni network in the country, and that's because we are a big program and we have one of the longest history in the country. So, for example, when I was looking into fellowship and jobs, thinking about in the future, I was actually surprised to see how many of our alumni were out in many different states and cities, and it was actually quite easy to reach out to them and then ask them many questions about the job markets or how things are sort of located and how things are working in various different cities. So I believe that's one of the major highlights of that program. And then also we have a very strong collaboration with the UT Health Houston program as well. So it's quite easy for us to reach out to the UT Health Houston faculty and alumni to also connect with them as well. And you see some pictures of our alumni, recent alumni here. Next slide, please. And let me just highlight some recent additions as well to the program. In terms of the curriculum, as Dr. Cortez mentioned, we last year implemented a full official MSK ultrasound curriculum. We completed 1 year, and this was received very positive feedback from the residents. As Dr. Cortez mentioned, this is led by Dr. John Sianka, who is the AAPM&R president-elect, and he also led multiple AAPM&R ultrasound course sessions. So we're very honored to have him as our facilitator for our ultrasound curriculum. And also, Jason currently actually is developing a spine injection training models where he is 3D printing phantom spines and installing into the ballistic gel. And we actually tested it yesterday. And then it actually gave us quite realistic representation of the spine. So we're excited to implement that into the curriculum in this coming year. In terms of the clinical side, we reopened Baylor McNair Inpatient Rehab. This was a unit that we had before, but because the hospital was moving, we had to temporarily shut it down. But we currently reopened, I believe, as of this January or early this January. And then we're actively also hiring new faculty to support as we're trying to expand this unit. Next slide, please. To go over some salaries and benefits. Next slide, please. I believe we have pretty competitive salaries for a major city. Personally, as a PGY4, since PGY1, I never thought that our salary was short because, as Jason mentioned earlier, Houston has one of the low cost of living when it comes to the major cities. And also, in terms of benefits, Baylor College of Medicine pays for our medical and dental insurance, so they come at no cost to residents. And these medical and dental insurance are actually fabulous. For example, to give a personal example, when I was an intern, I was admitted to the hospital for 2 weeks, then I had to get a surgery. And for the entire duration of 2 weeks inpatient surgery, anesthesia, I only had to pay out of pocket like $300. So it's quite great medical insurance we have. And then visions are covered, as I believe, around like $3 a year. That's very nominal cost. Book funding, we each year get $150 for book funding. And also for conferences, we get $1,000 for the first conference and then $500 for the second conference. And we have pretty generous time off here at Baylor in our PM&R program. We get 3 weeks scheduled vacation. And when the chiefs make the schedule, we make sure you're not in any, you don't have any call duties the weekend before and after. So this effectively makes your vacation into 9 days. We also have 9 PTO days you can use for educational opportunities such as conferences and 6 sick days as well. Next slide, please. And also, we have pretty easy moonlighting system here implemented into our program. And here at Baylor, moonlighting is an internal moonlighting where we are admitting patient at tier hospital. This is purely optional for those who are not into doing moonlighting. This is not required. And this is a scheduled weekend shift from Friday to Saturday and as needed weeknight coverages. And over the weekend shift, typical volume is about 4 to 8 patient admissions. So during this moonlighting shift, you're not covering any other floor patients. You're purely responsible for admitting patients. And there's a separate call resident who takes care of the admitted patients. And we get paid $207 per admission if the admission comes before 10 p.m. and then $307 if the admission comes after 10 p.m. Next slide, please. And before we conclude, let me just highlight some of the aspects that I love about Houston. Houston is a very affordable city where we also have very diverse food. Houston is known for our fabulous food scenes. And also, if you like nature, Houston is also known as the Bayou City. So we have tons of bayous you can walk through and enjoy nature. And also, in terms of research, one thing that we didn't highlight is that we also have NASA here at Houston, and Jason and I actually are doing some research in collaboration with NASA. So if anyone's interested in space medicine, that's an opportunity you can also look into. We also have
Dr. Jung, you have 5 minutes left.
Okay, thank you. And then we have a variety of sports teams, including Texans, Astros, Rockets, Dynamos, and Sabercats. So whatever your sports is, you can always pick and then go to those games after your work. Yeah. And then, yeah, that's it. If you have any questions, this is a email for our program coordinator, Nishan Franklin, as well as we chiefs have a chief email. It's PMRchiefs@bcm.edu. Sorry, I forgot to include it here. We'll put it in the chat.
I'm happy to take any questions if there are any.
Okay. How do we view, hold on, let me see, the applying? Yes, so there was a question about those who are reapplicants, basically. So those who did not match in the first round. Actually, yes, we do consider that. It's not that's why we, in our program, with regard to screening, we look at the whole application. And so we have had a couple of residents who who are reapplicants, basically.
I think there's a question about cancer rehab. How much exposure do residents get to cancer rehabilitation during training? Yeah, so we do have one dedicated cancer rehab attending. She is collaborating with the Cancer Center here at Baylor, and she is building up her practice. So you'll get exposure to cancer rehab through her. And also at Tier Memorial Hermann, when we do inpatient rehab, we actually have a fair number of patients coming from MD Anderson with diagnosis with cancer, whether it's sort of CNS cancer or other peripheral cancer. So you do get a fair bit of exposure in the inpatient side as well. And the next question is, do your program give any type of preference to applicants who are from the area, Texas?
Not really. I mean,
Don't think
everybody's
so.
from everywhere.
Yeah, I've been part of the recruitment committee before, and believe we don't have any sort of checkbox or scoring system where we prefer Texas applicants. We do, though, get a lot of applicants from Texas, so it may look like we have a lot of residents from Texas, but we don't give any preference to the applicants who are from Texas. And the next question, I believe, is, does your program take IMG for away rotations? Dr. Lee, I think.
Yeah, for away electives, away rotations, meaning like as a medical student, we don't. So basically, even observerships for medical students, MS3 and MS4, Baylor is pretty strict across the board. Unfortunately, we are not able to take that unless it's through VSLO for medical students.
Next question is from Antonio. What do you look for in international medical graduates when considering them for interviews?
Right.
Yeah.
So for international medical grad, again, it's a holistic review, basically. First of all, of course, looking at the school, you know, if it's through ACFMG certified, and also all the other components, everybody is pretty much screened or like, you know, judged equitably because we follow a rubric, basically. And so a lot of it really has different categories that we're looking for in a program, like life experiences, you know, how activities or things that people have done in the past to show their why PM&R. So those are important things, just to mention a few. And so when it comes to application, everybody's pretty much have the same footing.
And then we didn't mention this on our slides. We did have a fair number of international medical graduates from our program. We had one, we currently have one from India. And then last year during our PGY4 class, we had two people, one from Ghana and one from Peru.
So the only thing there perhaps for an IMG is that from a visa sponsorship, Baylor is only able to sponsor a J1. Okay. I mean, also just to open it up that, you know, for non-traditional paths, we have had not patients, sorry. We have had residents who had non-traditional paths as well. All right. Anything else? Well, thank you so much for your interest and all right, yeah. All right.
For your presentation.
All right. Thank you so much for sticking in until I know it's pretty late. Yeah, just let us know and we look forward to meeting you maybe in the path along the path and wish you all the best. Thank you. Have a good evening.
Thank you, everybody.